Live this morning. Is it nice or not outside in Kentuckiana? Glad to see that rain get out of here. It looks like we have a few days of sunshine, or not rain, but the rain may be back into forecast. We're going to be checking in with First Alert Storm Team meteorologist Jamie Martin in a few minutes. Good having you with us here on Louisville Live this morning. I'm your host, Craig Hoffman. I just love that blue sky out there. Isn't that pretty? Anyway, good having you with us here. We got a great show. You don't want to touch that dial. And if you're out there running in those 5 or 10Ks or maybe some fall football and you fall and you slip and you got some aches and pains and it's something you can't take care of, Apex Physical Therapy is here. They're going to tell you how to get better. Are you sore or anything from running and exercising around the house?
You know, man, I'm getting a lot better because I can run again now after that broken leg. So I'm a little bit sore because I'm back in the gym
coming
all the
up,
time.
we're going to be talking to Apex Physical Therapy on how you can feel good in case you have some aches and pains, really some serious ones.
Maybe I need to hang around for that.
Maybe you need to hang around for that. Rick, good having you with us here on Louisville Live this morning. I'm your host, Craig Hoffman. We are glad to have Patrick Myers with Apex Physical Therapy with us this morning. And if you got any aches and pains and you're not sure what to do about them, Apex Physical Therapy is the one who can get them out. Good having you with us.
Thanks, good to be here.
You know, I mentioned to Ricky a minute ago, he broke his foot several months ago. I think it was back in May. And he had to go through a recovery process. When you break a foot, when you have a severe strain or even shin splints, you may need physical therapy to get you back to where you were before. Explain how that happens.
Yeah, you know, the new kind of thought on physical therapy is taking people from a state of injury and bringing them back to something that they want to do functionally. And when we say functionally, we mean anything from sitting in a chair like this to working in an office to getting out cutting grass or working at Ford plants. Anything that is functional, movement-based, that's what we specialize in.
And I know I had knee surgery years ago, and ACL went out playing basketball, and whatever a physical therapist says, we were talking before we came out here, you listen to your physical therapist. Now, some people go, oh, it hurts too much or I can't do it. But when you have a major injury, physical therapy is the way to go. And so many people around here, we talk about it, have back problems. And that's one thing you do is you can get them on the right track again and give them ways to do exercises and the way to do it right.
Right. You know, one of the things, there's something going on in our field right now, and they say it's drugs, surgery, or us. And so that's our point, is give us a shot, because what we do in our clinic in particular, we specialize in what's called manual therapy. So we use hands and positioning to help your joints move in the appropriate fashion. So if you've injured yourself, you've got a joint that doesn't work right, muscle spasm, put your hands on someone, position their back, and then let them do the movement pain-free. So, you know, that's kind of a school of thought on physical therapy. They say, oh, there's a lot of pain, there's a lot of push, you've got to really go hard. You know, you do have to go hard, but what we also specialize in is doing things in the least painful manner possible.
And you see right now on your screen, they deal with manual medicine, orthopedic rehabilitation. A lot of athletes out there, fall football for the kids, and middle schools, and of course those 5 and 10Ks, work in industrial rehabilitation. It just goes on and on. I like that last one, fitness and wellness. You know, you may be a few pounds overweight, you may have sprained your ankle, but it seems like you're from A to Z, one-stop shopping.
Right. What I tell a patient when they come in is, first of all, I'm going to figure out what's going on with you and make you feel better, because you came in for pain management. You didn't come in to get your posture improved. But that's the second phase, is improving your posture or improving your strength in some way that's going to help you get out of pain. The last phase of your rehab is what we talk about, that wellness programming, where we decide what you want to do. You play tennis, you play basketball, you work in the yard, you like to hike. We take the exercises then and specialize them for what you like to do.
And this is a time of year, it's the beginning of fall today, and as the leaves drop, you'll be out there bending and this and that. And I've had my share of lower back and middle back problems, and you know, you can go to a chiropractor by all means, you can go to a physical therapist by all means, and you can go to your orthopedic doctor. But one thing I like is that for the past 20 years here in Kentucky, a lot of people go to the orthopedic doctor, they get a prescription or him to write a note to get you to physical therapy. In a lot of states, that's the way you have to do it, especially if you've been in a car wreck or some extremely serious injury. But if you slipped on your sidewalk at home on some ice, bending over on the leaves, you can go directly to you. You don't have to go to the orthopedic doctor if it's something not like extremely, extremely critical surgery or
Right.
something.
The way we work that is in 48 states, citizens have direct access to physical therapy in some form or fashion where they can get an evaluation that day. So they call the office today. There's a good likelihood they'll get in today and most certainly tomorrow. Now what we do, our skill set is what's called differential diagnosis. We look at someone and go, hey, this is a physical therapy thing. We can work with you. We can help you. Or in a lot of cases, we look at the body and we say, hey, this is something that the physician needs to see you for. You either need x-rays, some type of radiography, MRI, you need some medication to manage this, and then come back. Or it might be a situation where we just say, hey, look, this is your doctor thing. This is something that's out of a physical therapist's hands. And I think the good ones are confident enough in what they do that they actually can make that decision and help the doctors see the patient and help get that patient to the right doctor.
I know you're not a nutritionist or a dietitian or anything, but if someone is feeling some aches and pains because of either weight or a past injury, they're not sure what to do. Can they come to you and you say, okay, try this, this, and this, do these exercises? Is this a good starting point?
Sure, absolutely. In fact, we have a program for post-operative lap bands. And so what we do is we take patients that have been through that and put them on an exercise program that's safe and where they feel comfortable, not where they have to, a lot of times they'll go to the gym and they'll feel uncomfortable because everyone there is already in great shape, and they don't know how to use the equipment. So we can help you get into that kind of exercise mindset. And it's a great time to do it because we're going into the winter. Everyone's going to be indoors. Exercise this winter. You'll come out in the spring like a new chicken.
Well, I can tell you this. I have gone through physical therapy before, and it's really good having Patrick here with Apex because they know what they're talking about. They have different locations here in Kentuckiana. We want to share with you those locations where you could talk to Apex Physical Therapy. They're board certified. That means they're very good at what they do. There's their 3 locations: South English Station Road, Blankenbaker, East Crystal Drive in LaGrange. There's their phone number. Now you may say, I live 20 miles away. They can still help you. You can go online, send them an email. They'll be more than happy to respond. Apex Physical Therapy, 3 locations, and they keep growing because they're helping a lot of people in Kentuckiana. But really good having you with us here on Louisville Live this morning. And thanks for just laying out, because people at home may have had surgery years ago or just some nagging pains. And I think coming to you can really get them going.
Sure, thank you, and thanks for the time. They can catch me on the website.
Right.
They can hit my email and send me an email directly, and I'll be glad to answer any questions they have.
All right, Patrick Myers, he is the owner, not just works there, he is the owner, so you'll probably hear from him if you email. Thanks so much.
All right, thanks, Greg.